Hello, friends. My name is Dr. Nancy Trimbley, and this is your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my goal for you is that with each passing episode, you get closer to being your own best expert. So today we have a former guest, Katie Beeson, and her partners in her business of Mom Sense and Optimum Women's Health, and that is Rachel and Crystal. And we're going to do some introductions and just let the conversation take us. So, hi, Katie. How are you?
Hi, good to see you again.
Good to see you too. Hi, Rachel. You want to do your introduction for us?
Well, I will. I'm actually going to switch that up a little bit. I'm Racquel, but I
Oh, sorry.
Rachel all the time because, my mom just chose to do that to me. So
Oh, no.
I'm Racquel Krause. I am a nurse and a lactation consultant at Mom Sense, as well as partners with these guys with Optimum Women's Health.
Cool. And Crystal.
Hi, I am Crystal Morgan. I am a family nurse practitioner and lactation consultant as well. I'm one of the owners with these lovely ladies here, and I work with Mom Sense and Optimum and Just You as well.
Good, good. And what was the last one you mentioned?
Just You.
I love that. We didn't talk about that in our preamble, so tell me about Just You.
It is our aesthetic portion of the business. So it houses our skin wellness and massage therapist.
Wonderful.
Yeah, skin health and self-care entity.
Yes, so important for moms to remember to focus on themselves and keep themselves as a priority when there's little ones wandering around. So the Mom Sense we talked about, and one of the great things about what Katie and I talked about, Mom Sense is all these women, 3 women are lactation specialists. And the fact that lactation and breastfeeding are completely normal, and I forget exactly what Katie said, she said it so well, it's making natural normal again. Like this is an awesome way to start your baby's life and nutrition and getting them off on the right foot. And it is so, so, so important, not only for nutrition, but bonding. And today we wanted to focus on the Optimum Women's Health portion of it. So Racquel, do you want to tell us more about that?
Sure. So Optimum Women's Health is basically a women's health clinic. And our focus is really trying to get to the root cause of people's problems and help them throughout any span of life. So a lot of my Mom Sense patients are having other issues as well. Let's face it, when babies enter and then leave your body, things can happen. And so many times, I know myself personally, and a lot of my patients have said that, when they're having issues and they go to their doctor, they either hear, well, of course you're tired, you're a mom, or it's just your anxiety or whatever. And so many times they get dismissed and that gets overlooked. And that's what we're looking at Optimum, is trying to be that bridge to say, you're not crazy. There's a reason when your baby sleeps, you can't sleep. And that's because you grew a human inside of you and you're nutritionally depleted, or, you need some health, or lab aspects to be looked at and figure out what's going on. And that's kind of the big difference in how we look at women's health versus the women's health providers out there.
Exactly. I get a similar thing with chiropractic where patients will come in and say, well, my family doctor said I had arthritis. And I say, did they wave their hand at you like kind of like this? Like, yes, I'm dismissing you. Oh, you have arthritis. Go away.
Yes.
And sometimes it's not even true. They don't have arthritis. And maybe if they do, it doesn't mean we can't help them. So it's the same like what you're doing.
Right. Absolutely.
There is a reason. There's things we can look at. So following that path, what types of ways do you check into what's going on with a woman's health?
Well, I'm actually probably going to defer that to Crystal, since she sees the patients over there, and I am just a patient over there. So.
Okay, Crystal, let's hear it.
So we start off with labs. pretty much. It just depends on what they're complaining about. But most times from the mom sense side, the patient's moms are tired, or even when they are struggling with anything with their mental health, whether, anxieties or depressions. They were on meds before, they want to restart them, or they restarted them, they're not working. So before I initiate anything, I always like to get labs so that I know our baselines, if we're deficient in anything, so that we can supplement and replace before we talk about any type of prescription medication, because I try to explain all the time. We talk about gut health and absorption, and even just getting you at a normal baseline level before we can even decide what are your real symptoms.
Right. Yeah. If you hang out in our office, you'll hear all the time, people aren't deficient in Zoloft.
Right.
People are deficient.
No, they're not.
Minerals.
No.
And so figuring that out, and so many times, I mean, we'll pop them over to Crystal and she's like, well, their vitamin D is 12. We knew that. Of course it is.
You got to start there.
Yeah.
And then, work our way up.
Right. So looking at it from a more holistic viewpoint, and to me, getting people away from drugs, prescription and non-prescription drugs should be paramount, because we're watching our older population age out with more and more and more metabolic problems, cognitive problems, health and heart problems. So obviously this mass medication in the U.S. is not working.
Right.
So I fully believe that we need to let's get the basics covered first. So when you recommend supplementation, is it kind of like the thing where it's there you see some trends that a lot of new moms have that they need help in, or is it all over?
There tend to be trends. Maybe it depends on the day. It could be a trend or it could be all over. I'll say that.
Right.
I see a lot of vitamin D deficiency.
Yes.
That is probably top.
Number one.
Yeah. I also see a lot of, I'll see some anemia, but definitely after pregnancy, a lot of women are struggling with thyroid. So I've seen a lot of thyroid labs off.
Right.
Mm-hmm.
Right. And my big thing about our health and wellness is that when your body's depleted, and especially energy wise, and that affects your mood, and then also affects your connection to other humans. Like you can't connect like you should because you're just so overwhelmed by your fatigue. And now we're dealing with a newborn life that is forming every day, every hour is gathering information. We want that mom to be so much her best self. So I applaud you. It's so important to be checking this. And you are very busy. I know you're very busy because I see a lot of your babies in my office, and it's exciting to see new moms really really think about that and not just accept what their family doctor says, like, oh, don't worry about it, you're fine. Now let's talk. Now I know for vitamin D there's some great supplementation. Also, just getting literally out in the sun is great. And I know for thyroid that can be a little tricky. Could be supplements, could be medication. Now, what does a woman do with iron deficiency? How is that best addressed?
For me personally, I just start with diet with iron.
Really?
Yes.
And what kind of dietary changes do you make?
We want dark greens. We want some of our red meats. We can get some from some of our fruits. So it just depends on what they like, don't like. And then we kind of go from there. A lot of times too, if we increase their vitamin D, haven't figured out why exactly, but that naturally tends to go up as well.
Yeah.
The iron does too?
It's all absorption. Yeah.
Huh. I gotta say, one thing I like to gush about Crystal when I tell people about, going to see her, is that she is she's kind of like a detective / mechanic, right? Like she cares so deeply about the why, and that's so individualized. So rather than what we're typically seeing, it's like, well, you have anemia, here's an iron pill, right? She's going to go deeper than that. She's going to take so much of her personal time, so much of her energy and her love for her patients, and go deep. So it's like, it's not a one size fits all at all. And it's very different from what most people have experienced, like you said. Because, the reason we call this place Mom Sense is because we were like, well, you have an inner knowing, you have a sense, and you've been dismissed. So as far as, being in Optimum Women's Health and seeing one of our nurse practitioners, Crystal, or Allison is another nurse practitioner we have, they're giving you time. I mean, what's the average time that you spend with a new patient?
It's probably 45 minutes to an hour.
Yeah, for a first visit.
Yeah, for a first visit. And then our follow-ups are at least 30 minutes.
Wow.
And she's going to look at everything during that time. Yeah, she's like the detective.
Right. But you know what?
That is so cool.
Yes. And make it real. You're right. I think hearing you say, and like hearing Katie say it again about being our Mom Sense listening, I think that's what I'm trying to accomplish through Optimum as well. It's like you're doing that. You're getting the senses for your baby because of our maternal intuitions. But you need to do that for yourself too. Like, it's not okay for your provider to just say, oh, take this pill, without a real why or how, or if it's no longer working, then going back to the drawing board instead of, I don't know what else to do, or there's nothing else that we can do, because that's not true. Right. But a lot of times women, we just kind of give up, especially if we are trying to put into ourselves. If we get too much resistance, we're going to stop prioritizing ourselves, and it'll go back to what we were doing, our kids, our husband, any and everything else besides ourselves.
Right. Absolutely.
So true. I try to teach my patients, and I talk about it in my book, Stealth Health, that medical doctors, the conventional medical model is name the disease, treat the disease. Mm-hmm. So somebody goes in and they have low vitamin D, or they have depression, or let's say depression. Okay, how do we treat depression? Oh, here's what my tools are: a drug and an intervention. That's what I have. An intervention doesn't apply as, okay, there's a drug, and then that's it. Then their job is done. But because their tools are very limited in conventional medical model, but you are working from a holistic model of asking why, and that's one of the biggest frustrations I have with the conventional medical model. As we see, before COVID, it was all these dialysis centers going up. Right now, it's all these dementia centers being built. And I'm saying, oh my gosh, why isn't somebody saying why?
Right.
Why is this happening?
Cancer centers and dementia centers. Yeah.
Oh my gosh.
Yeah.
Oh my gosh. It's so sad for the American people, because they think that's the only way. And it's people like you guys that go out on a limb, take a risk, open this business, attract people in by associating with people like me, who then we just start waking up these minds one by one.
Yeah.
You wake up the mom's mind. That is so powerful, because she is the captain of the ship when it comes to healthcare and her family.
Absolutely.
Choices. Mm-hmm.
Absolutely. And once you wake up to that, you can't go back.
Right.
I mean, you really
so true.
Can't go back. And then you start like running through all the things that you've personally encountered in your life, and you're like, oh, I do not want another person, another human, let alone another woman, right, to ever have to experience that. Right. My kids would be so much healthier today if someone had taken my health seriously, and if I had been opened, my eyes open sooner. So it's not just about me. It's not just about me. So
true. It's the trickle down, it's the ripple out, it's all those effects that we not only as individuals have, but moms, it's compounded.
Right.
Because they're forming the next generation.
Right. And sometimes all it takes is someone actually sitting down and listening to you. I think that's something we hear across all of our businesses here is nobody's ever taken this much time to actually listen to me. And if I leave no other legacy,
we're great listeners.
Right. I want it to be that. We will listen and we will help. We will find a way.
We sure will. Yes.
That is phenomenal. That is so cool. What's your, I'll ask this both Racquel and Crystal. I don't want to say what's your favorite patient, but what when you see when somebody walks in the door with either a certain problem or their certain age range, um, what's your best success? Like, tell me a story about that.
Hmm. I think if I'm going to be looking at the mom sense portion of things. So I think I don't know, most memorable story comes from a mom who did not have a lot of resources. She loved her baby, but did not have a lot of ways to help her baby, and was completely dismissed by the pediatrician. And her baby was not gaining weight. And by the time I saw them, the baby was probably 6 weeks old and was a pound under birth weight.
Oh
I mean, we're
no.
talking very serious. Got dismissed every time she asked about it. Started working with us. We found the root cause of that problem, which was a tongue tie in that case, and worked through that with her. She got reported to CPS because her baby wasn't gaining weight, even though she was the only one really advocating for her baby until she got here.
Mm-hmm.
And of course, that was cleared up pretty quickly when we spoke to all the people involved and said, no, if you want to look at anybody, look at the doctor who blew this off. And yeah, she just sent me a picture the other day. He is 2.5 years old. He is thriving. He is the cutest little blondie ever. And knowing not only did I help that baby, but I helped that mom. She was a young mom and she was doing everything she could and had nothing out there to support her. And that broke my heart. That broke my heart.
So true. And it just, to me, it's malpractice on the pediatrician's part. And every time I hear a story like that where there's the dismissal and not a referral to somebody holistic. Like, okay, we've exhausted medical care. I don't know what to do for you, but I know about I know about mom sense. I know about this naturopath. I know about this homeopath. I know about this functional medicine.
Right.
Let's try that. That to me is unforgivable. It's so
Right.
sad, but that is a great success story.
Yeah. That one touches
Yeah, and
my
you
heart.
gave
And it will
you gave
forever.
her power back. Yeah, she
Right.
as a mom now she feels like she's in charge and she's more powerful and
Right.
she can do this. Oh my
Yeah.
gosh.
And the coolest part of it all too was she was my patient, but everybody here knew little man, right? And every time he would come in for a weight check or something, they'd be like, how's little man doing today? How's, and so everybody was invested, even though it was my patient. When we talked about the whole CPS thing, they were literally every person here was like, I'll talk to him. I'll go to court. I'll do, what do we need to do?
Wow.
Yeah, because it's family, right?
Oh my
We're
gosh.
family. We care about our patients, and it was just, literally bringing
Super
tears
cool
right now. So
super cool. I know.
Yeah.
I know. Hey, Crystal, you tell me a story.
All right. I think I have one from each Mom Sense and Optimum. Mom Sense, I would have to say, well, I do the procedures. So I love doing the procedures for babies, of course, just because I'm helping them accomplish their goals. And,
So just to tell the audience,
Yes.
so the procedure that Crystal's talking about is the tongue tie, lip tie, cheek tie releases.
Mhm.
And if you haven't watched Katie's episode, do that. But it's where those bands of tissue for some babies and actually some adults are too thick or they're too long, and the babies cannot nurse properly. So they don't get their nutrition, or they swallow a lot of air, or they have pain when they're nursing. So in the case of little man, he wasn't gaining weight. And so, Crystal, you actually do the procedures, which fascinates me because I know nothing about this. So tell us your story, and then I have questions.
Okay. So, well, I love doing them on the babies, but with moms, sometimes, they're so focused on feedings that they want to quit breastfeeding because they feel like, that's the problem. And so I love when it's an older kid or an adult and they get a procedure, they have that release, and they have immediate results from things that they were feeling or experiencing before the procedure. That does something for me because that goes to show that it's not just about breastfeeding, it's about overall total health, and that helps kickstart a whole nother discussion. And so that's
It
always
does.
exciting for me.
Yeah. So for the audience, these this extra tissue or bands that you might have in your mouth are part of the myofascial system. The myofascia is a very thin tissue, like as thin as a Kleenex tissue that surrounds every organ, every muscle, and it is one continuous band in the body. So when we release these ties that are in the mouth, very often people notice differences with their posture, how their neck feels. What else do you notice?
Oh, all the way down to their feet. We'll have
Mhm.
so immediate release of tension from neck, shoulders, back, hips, posture, like you said.
Stop toe walking.
Yes, not on
They
a
stop toe walk. Oh my
yes,
gosh, that's
or
that
feet
makes total
turned
sense.
in. They still have flat feet, of course, but they're not walking with their feet rolling in or their knees touching, or breathing better, sleeping better. Those kind of
Wow.
happen right away.
What tyrants?
That
Yes,
totally makes
smiling
sense.
is one. Like my husband had his procedure done a couple months ago, and he said it doesn't hurt to smile. And
Aw.
to hear him say that was kind of funny because we always just called him like non-photogenic. So look at pictures before you look at him, and he does look like he is in pain. And if you look at him now, you can actually see like his teeth and both the top and the bottom, not just the bottom.
Right.
And he just looks relaxed. He just looks more relaxed.
That's
Oh
one
my
of the
gosh, what a
numbers.
blessing he was married to you.
For many reasons.
For many reasons.
It's one of the first things we hear about when we have our follow-up for our babies post-procedure a couple weeks later. It's one of the number one things we hear is they're just more relaxed. They just seem happier. Am I crazy, or is this baby just here?
Yeah.
I'm like, well, no, you're not. That's kind of consistent.
Right.
Yes. And one of the fascinating, when Katie and I did the podcast, she said back in the day when there was midwives, which still should be the case today, but they had one long fingernail and they would kind of do a release like of all the ties. And yeah, nobody, why don't we do that? Like, why don't we just do that as a routine? It sounds like something that could be done. That's so cool. So what was the other story you had? You had
my other story
optimum
is an optimum patient, and it involves Racquel's her best friend's daughter. She was coming to me for some of the functional things. Like she didn't want to take medications, but she wanted some baselines to figure out why she was feeling the way she was. She was trying to get pregnant. She had been married. They had been trying and nothing was working. So we drew her labs where she was deficient. We supplemented, and she was coming back had to have been 6 or 8 weeks after we started supplements. We were going to reorder some labs, change some things up. And she came to the appointment just to tell me that she was pregnant. So that kind of made my day.
And mine.
Absolutely. Absolutely.
Yeah.
Absolutely.
And mom sends patients now because the baby has been born and he's amazing. And yeah.
That is super cool. I believe that if we just give the body what it needs and eliminate obstacles, the self-healing is just miracles.
Get rid of the toxins, put in the good stuff, let the body do what it knows how to do.
It talks to you if you know what it's saying. If we listen, it tells us. And when we take those medications for the symptoms that we complained about and we still have those symptoms, that's your body telling you that that's not your problem. So keep looking.
That is so true. That is so true. I feel like that's what I do every day too, is I just listen to the body. The body's going to reveal to me what it needs. How do you experience that, Priscilla, when you're working one-on-one with somebody?
Just listening to it, like, I guess just encouraging patients to be more in tune with themselves. Like, when you get that headache, track it, write it down. Think about the things you ate before that. What were you doing? Like, let's do that for a couple weeks if it's someone who gets frequent headaches, and let's see if we can figure out what's triggering it. Okay, well, now you can see that you get a headache every time you eat a sandwich. Well, let's talk about our wheat and gluten, like that sort of stuff.
Very, very cool. And I've had 12 or 14 associate doctors over the years. And in chiropractic, we have ways that we assess the body and assess the spine and the nerve system to see where the adjustments need to be done. And I always tell them, the body's going to speak to you, and sometimes it speaks to you by the person's words. So you also have to listen to what they're saying, because very often they'll divulge something that is the secret to solving the puzzle.
Right. And I know I hear, and I'm sure you hear it a lot too, my patients will preface things with, this is probably stupid, but because they need to think that what they're saying is not important.
Right.
And I'm like, sometimes it's the tiniest details that actually get you the answer. So just, you tell me everything. If your foot is twitching, I want to know. I mean, it does make a difference to really let the body tell you what it needs.
Yes.
And I said the same thing with chiropractic care when we send our patients to you or anybody else, depending on where they live. I'm not going to tell you what to tell them to do, because they know how to read what the body needs. So let them do their thing. That's what they should be doing.
Right. Exactly. Awesome. All right. So I have one final question for Racquel and for Crystal.
Okay.
If you had a billboard for all to see, what would it say?
Oh, there's so many things I could answer that with, some of which might get me in trouble.
Good. Get in trouble. That's what this is all about. I feel like if I'm not making somebody mad, I'm not doing my job.
Yeah, I think the basic, if I'm just going with a basic billboard, it's trust your mom sense. Because ultimately we know when something's wrong, whether it's about you or your baby. That would probably be my billboard on a basic level.
I think I'm going to have to go the self-care route. So it would be self-care is or should not be a luxury.
Right.
Ooh.
Self-care is a need. Yeah. Take care of you so you can take care of them.
Mm-hmm. Yes.
I mean,
yes,
we can keep going. No,
keep
How many billboards can we put up in Northwest Indiana?
Go ahead. I want to hear what you want to say. Let me know, Racquel.
Yeah, you deserve more. Like, you deserve to be taken care of. So.
Yeah, absolutely. I love it. And that's why I do this podcast, and that's why I call it Your Healthcare Arsenal, because we all need our arsenal. We need our arsenal around us, so that when things do go awry, which they inevitably will, we have this group of people that we trust, that we know, that know us, that are holistic in thinking, that are looking at us as a whole person. And so for me at my office, when somebody comes in, there's a good chance when they show up, I'm going to be able to help them. But if it's outside of my scope or, my ballpark, I have a whole group of people that I can refer them to get the help that they need. So yeah, I love your thinking that. What'd you say again, Crystal? Self-care is not a luxury.
Right. Yeah.
Yeah. Absolutely.
I want to know what your board would be, though.
What's that? What my bill? Oh, wow. I've never been asked that. Oh, no. Let's see.
Oh, no. Yeah, see what I mean?
Yeah. I think my billboard today, it would say, be your own best expert.
I love that.
I like that.
That's perfect. Yes. All right.
Yeah. Tomorrow could be different, but that's my billboard today.
Yeah. Yeah. It's a Good Friday billboard.
Yep.
I love it.
It's a Good Friday billboard. Yeah. Because, you go to a medical doctor and people are just like blind and deaf, and they're just like, okay, I'll do what you tell me to do. And again, in Stealth Health, what I teach, I forget what chapter is, might be chapter 4, is if you go to your medical doctor and they say, okay, we're going to send you for this test, a barium study, like for your upper GI, or a CAT scan, or an MRI, or whatever it is, ask these questions. If something shows up on that report for this test, what do we do? And if they take you down a path that you do not want to go down, whether it's a medication or surgical intervention, don't do the test. With this caveat, if you just need information to gain wisdom about your own health and what's going on and take a different route, that's one thing, but you need to do that deliberately. Sometimes you'll ask the question, well, if something shows up, what are we going to do? And they tell you something. And then the next question is, well, what happens if we do the test and nothing shows up? And they say the same thing. If the outcome doesn't change based on the test results, don't do the test. It's a waste of your time. It's a benefit to their pocketbook.
And we're not healthy.
And so many of these tests scare people.
Mhm.
These tiny little incidental findings show up, which sends them into a stress mode, which is so bad for us. Like,
Right.
I don't think we have any idea how bad this chronic stress is for us.
Oh, yeah, cortisol, not our friends.
Inflammation.
Yeah.
Yeah. Awful.
Yep, all that. So this has been an awesome conversation. Thank you so much. And for all of our audience out there, this has been your Healthcare Arsenal podcast. And as always, my hope for you is that with each passing episode, you get closer to being your own best expert. Bye for now.